Hello and welcome to Let's Talk Climate. I'm Bruce Bekkar, fellow at Climate for Health at ecoAmerica, and I'm coming to you from northern San Diego on the coast, lands once shepherded by the Kumeyaay Indians. I'm very much looking forward to today's topic, nurses leading on climate locally, with our guests, Dr. Janice Hawkins, Clinical Associate Professor at Old Dominion University School of Nursing in Norfolk, Virginia, and Dr. Sarah Brown Blake, Assistant Professor and Graduate Program Coordinator at Chico State School of Nursing in Northern Central California. Thank you both so much for being here today.
Glad to be here.
We're co-hosting today's episode with the Alliance of Nurses for Healthy Environments, or ANHE. So welcome to you both.
Thank you.
We're going to jump right in. Janice, you have talked a little bit with us previously about the themed semester program. What are you doing in this course, if you could explain it a little bit, to help nursing students learn more about climate change and take actions that are going to help out with our climate crisis?
Definitely. This is at ODU where I teach. This is our second year of the themed semester. And that's, the idea that we get everybody on campus talking about the same thing all at one time. And we were actually already planning to put a little more content into some of our nursing courses and even one of our pre-health courses, Health 101, that freshman students take. And so we were delighted when we found out the theme semester was going to be about sustainability. So we, sort of said, hey, we're going to do that. So we signed up to be a part of the semester-wide initiative. So things we're doing, some easy things, like we're going to have all our students do the personal carbon footprint calculator and just learn a little bit more about how they could reduce their own carbon footprints. We're going to have them take the Climate for Health Ambassador training, and then we hope that they'll put that into real world actions. So we're going to have a little competition and maybe have groups of teams come together and decide what they might do on campus, such as, what could they do in the cafeteria to reduce energy use, or what could they do in the dorms or in our nursing building or things like that. That's some of them. We do plan to have some guest speakers. I don't think our students know that the healthcare industry itself is responsible for, in the US, 5% of greenhouse gases. So I think even just learning that will make them more aware on campus and make them more conscientious about helping reduce that when they're at work.
I think one of the silver linings to the pandemic was everybody working in healthcare certainly got to see the vast amount of waste, just the tremendous amount of materials that got thrown away after being used once, or maybe even less than once in some cases. So if there was a silver lining to that cloud, maybe that's a valued learning that you can key off of when you start talking about sustainability in healthcare. And there are a lot of people that I think just naturally kind of gravitate towards that when they think about climate action. They want to reduce waste around them. So it's a golden opportunity.
And we're kind of calling it, and Sarah, I think you'll appreciate this, the windshield survey, because I know you're a community health faculty. We're going to kind of add this to our windshield survey. In addition to all the things that are associated with the traditional windshield survey, what else do you see in the communities on campus related to energy efficiency and things that we can do to be more sustainable? So we think that's going to be a good permanent add that we can tack on to the bottom of that. So feel free to use that in your class too, if that's interesting to you.
Oh, that's great, Janice. Thank you. Yeah, what a great use of that tool.
Sarah, what does this make you think of where you are in terms of sustainability of the school and just healthcare in general?
Yeah, so I think Chico State certainly is way ahead of the game in terms of their vision and mission in terms of sustainability. And so the School of Nursing is really we are surrounded by thinking about this. And we are incorporating more content about climate justice, climate change, environmental health into the curriculum across the board. So not just in that public and community health nursing course where it typically is found, but across, in the practice areas, the acute care practice areas where that waste really is occurring. Water use is a major issue. So really having the students think about their day-to-day impact, even at the bedside. So bringing it from the, out to the community, but also in the practice setting.
Yes.
Other practice settings, yeah.
Great. Sarah, you did something called the Ehn Fellowship Program. Is that?
Yeah,
Tell us a bit about
yes.
that.
So the Alliance of Nurses for Healthy Environments initiated and had an inaugural environmental health nurses fellowship in 2020. It was actually 2019 to 2020. So it was kind of an interesting time to be kind of casting off a new program with Annie. And, you know, I really felt I wanted to take part and apply for the fellowship, and I was lucky enough to get in. It was sort of at the time, it was sort of immediately after the Camp Fire in Butte County, one of the deadliest and largest wildfires in recent history, California's recent history. And so it was sort of a way to sort of propel me into working with our community to recover and build some resiliency. And out of that, I focused a project, a community project. I worked with a mobile medical clinic that was operating up in Paradise with unhoused residents. And we really found that mental health was the primary sort of short and long-term impact to this climate related disaster. And so since then, obviously the pandemic has been a challenge, but also has exacerbated a lot of the mental health challenges in our region. But out of it, our students and the university and the School of Nursing has an opportunity to work with a building resilience community center up in Paradise to really kind of build back some of the really positive connections, community connections that have developed out of an awful disaster in order to prepare for future challenges in the community.
That's really interesting. And I guess what I started thinking when you were talking about that was that the losses can be dealt with if you lose your home or things like that. There are ways to rebuild, certainly, and people are doing that after what we used to call natural disasters. I'm not sure they're natural disasters anymore. But the mental health impacts are maybe more lasting and more profound in many cases because you can't erase what you've been through, at least not very easily. So that's a really important thing, and it makes me think, first of all, and we'll put this resource with our recording of this webinar later from the mental health report that ecoAmerica had put out just a few months ago, which I think is a really valuable resource. And certainly what you were mentioning is that people with pre-existing mental health issues are even more vulnerable to these kinds of climate-related disasters. But it's also just ordinary folks. I mean, if you go through enough of a trauma related to your home and your family and your town, there is really not a person who wouldn't be affected in some way, and oftentimes permanently, by this sort of thing. And we can't even tell those people that, hey, you made it through, you won't have to deal with this again, because until we can get our climate restabilized and bring CO2 levels down, we're looking at this being a recurring problem. So it makes it, I think, even more difficult to help people get through this. How did it add to your, and you also talked about sort of the positive aspect, the really good community connections. Did it make you feel different? Was this more of a community engagement than you'd had before you got into this outreach?
Certainly with this community, I actually don't live in Chico. So I live 2 hours south in Davis, which is also impacted by some of the same climate-related challenges and impacts. Certainly heat, water quality, and water availability is a huge issue. But the fellowship really allowed me to kind of dive in and get to know my community better. And so now I have sort of kind of accelerated my connection with the community. And now I have a lot of trusted partners that I can work with, at least to connect them to resources, and it goes both ways. So it really accelerated that process. But Annie also, the fellowship also allowed me to really develop some advocacy skills at the local, state, and national level, to start practicing some of these skills as a nurse, as the most trusted profession in the US. And so, I've been able to do a lot of networking and have some opportunities to collaborate with other faculty members and professional nurses across the country. So it was a huge advantage to my professional and personal career and personal life. It's passionate.
Did it make you feel in any way better to be engaged like that when you saw this crisis unfolding?
Oh, absolutely. Yeah. And now I think now that we have greater connections, we feel more empowered to use those resources when we'll need them again.
Yeah, great.
So,
Janice, I see you nodding your head. What is this making you think about?
I think anytime we can get nurses more engaged, nurses are the ones on the front line that are working with the communities, and they understand the problems. And I think anytime we can get nurses more engaged with these type of activities, I think we're going to have more actions.
Absolutely. Okay, Janice, coming back to you, you've got an article coming out in, I guess, a publication called Nurse Leader about activities that will both reduce greenhouse gas output and also costs for hospitals and medical centers. Can you tell us some about these A to Z activities that are in this article?
Yeah, definitely. This is a fun article to write. As ambassadors for ANHE, one of the things we agree to do is talk more about climate actions. And I think we want to talk more beyond ourselves. Those of us on this call are very interested in this. Those that plug into Let's Talk Climate are interested. But when we're able to publish in other journals, then we have those beyond those of us that are naturally drawn to this. And so I'm real excited this is going to go in Nurse Leader, because nurse leaders are often the ones that can impact change at their facilities. So we really just came up with a list. We first presented this at a conference in March in Washington, D.C., and it was just an A to Z list of things you can do at your hospital to reduce the carbon footprint. And guess what? You can save money at the same time. So it just started off with things like adopt LED lighting. One of my favorite ones is probably L. I share this example a lot because L was lower linen par levels. Sarah Wolford is the sustainability director at Carillion Hospital in the western part of Virginia, where I'm from. And one thing that they did is they just, as nurses, I think we were taught to save steps. And to save steps, you just walk into the room with everything you might need for the next 30 days of taking care of that patient, which has historically meant bringing in, extra linens, extra supplies. Well, now that we're starting to think a little bit more about the climate, we realize that those things get thrown out. Or we wash, and I didn't know this number until recently, hospitals wash 10 billion pounds of linen annually. And a lot of times those are clean linens, because they're the ones we took in the room that are now dirty. So at Sarah Wolford at Carillion Hospital, they started reducing their linen par level, just re-educating the nurses and saying, stop taking so many in the room. And also they looked at their bed policy changes, and they still change beds as needed, but maybe didn't change them every single day. And they saved their hospital $80,000. And I don't remember if that was in 6 months or a year, but $80,000 just by educating. So they didn't have to buy a new HVAC system or solar panels, just that simple. So that's we did an A to Z list of things like that. Some of them that you can implement immediately, and some that take a little more work. But another super easy one is the anesthetic gases, by switching from to sevoflurane from desflurane. One hospital in Providence, Rhode Island, I think saved $500,000 in a year just by prioritizing that gas that is a lot more climate friendly.
Low-hanging fruit, as we call it. But also the win-win side of all of this, right? That not only are we doing something to help ultimately with our climate crisis, but we are also saving money and improving outcomes too. And we're seeing more and more examples of that. So It's part of what makes doing this work to me so energizing, is that there are so many opportunities for winning on multiple levels and addressing so many problems that we have neglected for way too long.
And I kind of hope, I like that you use that term low-hanging fruit, because that's how we kind of intended the article to be. The hope would be that somebody will go, oh my gosh, that's so easy, I'll do that. But then they kind of get hooked, and then they go for a little bit higher hanging fruit.
Absolutely right. And I've been involved for many years in the climate and environmental space. And I just find that people, especially, I think, people in healthcare that get the risk that we're running, because we sort of understand the dynamics and homeostasis and balance, and getting nature out of balance is like seeing a patient end up in the ICU. It's just something we can't allow if we can prevent it. But the fact that once you start to get involved, it's almost like a gateway drug. You want more of that. When you sense that I don't have to just be worried about this, I can be involved in helping solve this problem and also solve other problems too, you want more of it. So I never have a problem asking people to engage in healthcare and climate advocacy, because I know that we're all kind of wired the same way. And it'll actually add to their, not only to their own personal sense of inner peace, but also to their professional satisfaction. And Sarah, you were talking about that, how your work in the community has sort of broadened your career, and you can go back to those connections that you've made and do other great things with them.
Yeah, and I think, Janice, I'm going to sign your article to look for it and then share it with my colleagues as well, because our students who are going to be leading the charge with us and really carrying this on, and they are aware, and they very much want to talk about it in class, and they want solutions that are, you know, the low-hanging fruit, and they want to be able to see themselves as agents of change, and moving forward with some of these initiatives in all practice areas.
There's plenty of room for people to participate. A lot of times they just need to know where the on-ramp is.
Yeah.
And once they get on there, they're probably going to stay on there, and miracles come from things like that. All right, we don't have a lot of time. I want to get to one more question. It's for both of you, but I'll ask you, Sarah, to jump in on this first regarding the LMS training, the on-demand training for the ambassadors program. And as you were alluding to, polls tell us that nurses are the most trusted voices within communities, even more than just us doctors. How can the on-demand Climate for Health ambassador training help nurses to promote climate action, not only where they work, but also where they live?
Oh, I think it was the most accessible training and content to provide healthcare professionals and nurses in particular with some good foundational content on climate change and climate justice. But then the activities really provided you an opportunity to practice in the moment on your own at your own pace. But strategies that we can apply in a variety of different areas, either nurse advocacy, in practice, to really have these important conversations and to kind of frame them for either our clients, our patients, or maybe even more importantly, our colleagues, so we can expand the sort of force for good in terms of climate, climate change and the approaches we're taking.
Yes, absolutely. Janice?
I think I'll add to that too, that I think, of course, the knowledge content, I think it provides real specific knowledge to help our students, well, not just students, everyone that takes the training, learn how to talk about climate. And to learn how to talk to policymakers. We have our own language that we use in healthcare, and sometimes we don't realize that other disciplines use different languages. So for example, even to walk in to meet with a Congress member and to learn to use the ask. We came here because we want to ask you to do something, and the leave behinds. We're going to leave our materials with you with these numbers on them, and here's what we want from you. I think it learned, nurses are smart. They intuitively know how to do some of these things, but it's a different arena for us. So I think the training introduces us to that environment. And then one other thing I might mention is digital advocacy. There's one module in the training that helps you learn more to be a digital advocate, to use your social media platforms in an appropriate way, and also to learn how to not use them inappropriately, don't engage the trolls, how to steer away from conversations that are maybe not on target. But I think our students, they have the platforms, and so to learn to use them for advocacy is probably an area where they're going to be really comfortable engaging. And as you said, then it's the gateway drug. Then they learn they can do a little bit more and step up those skills and maybe develop their advocacy skills, which for me, I confess, were late coming. Even though I've been a nurse for over 30 years, I really didn't talk to policymakers until about 5 years ago. So I think that's something I want the next generation to do a little sooner. And I agree with Sarah, I think they are, and they want to.
I think it's natural for them. Most of the students are doing this all the time anyway. They're on Twitter, they're on TikTok, they're doing all of these. They're living with their phones in their hands 25 hours a day. This just gives them something to do with those phones and those platforms that is really constructive. And it's almost, I think, in our world, in a way, if things don't get posted, if you have some kind of a community action and nobody wrote a blog about it or posted about it on Twitter, it's almost like it didn't happen. Mm-hmm. So I'm trying to become a quasi millennial and get more comfortable doing this posting stuff. And it isn't impossible to learn, Janice. It is just it's another form of communication. But I think in particular for nursing students, it's a wonderful thing to get them involved. So I'm glad you brought that up. All right, I just want to ask either of you if you have anything else you'd like to add to this discussion. If you imagine you're talking to nurses anywhere who are curious about this ambassador training and advocacy, and I mean, how would you tell them that this is a worthwhile place for them to invest their time? Either one. Sarah?
I've got a comment, Sarah. I'll just add it. I think one thing about investing here is it puts you in connection with others that are already doing the same things you're doing. So I feel like after this meeting today, I just met Sarah and I want to connect with her and share some ideas because we're doing the same work out on the West Coast. There's more fires here on the East Coast. We're dealing with sea level rise and things like that. So it's different, but the same. But by joining this community and becoming a part of the ANHE and others that are talking about climate, we hear positive things that people are doing. So it's not just the negative news that's happening out there, but it's we're connecting with others and realizing what they're doing. And sometimes we can borrow their ideas and share them or just feel a part of a community.
Excellent. Sarah?
Yeah, I think prior to my engagement with Alliance for Nurses for Healthy Environments and my fellowship, I kind of felt a little alone. I don't know if you felt that way, Janice, where you're like, environmental health and climate change were kind of in my sphere or my wheelhouse, but I didn't feel like I had that many allies. And then you realize there are so many, and this is the Climate Ambassador training is a great way to expand that network. I love that reason for it, but also really just to have that foundational knowledge and the way to kind of communicate that information so that it translates to patients, colleagues, and policymakers, as Janice pointed out.
Yes, and I'm personally hoping that you two will be in contact with each other and will learn from each other and be part of ANHE's efforts to really mobilize the nursing community, because you all are so well respected and you're so deserving of that respect. And here's a real opportunity to prevent so much suffering. And it's part of our professional promise to society, but I think it's also just part of who we are. So I'm really grateful to have a chance to watch these partnerships bloom, and I hope to be able to do more of that in the future. Anyway, I think that concludes our time today, but I want to thank you both again for motivating our audience to think about really bold climate action, to step into new areas, to help improve the health of everyone. And you all can become a trained Climate for Health ambassador by visiting the Climate for Health website to learn more and sign up. Engage with us online with the hashtag Let's Talk Climate, all one word, and be sure to subscribe and follow us for the latest thought leadership, resources, and episodes on climate action and advocacy. From everybody here at ecoAmerica and Climate for Health, thank you very much for being here. Please join us in caring for our climate in order to care for our health. Be well, stay safe, take action. Thank you.